Disease awareness education exists to inform the public about diseases and conditions and their available treatments. Over the last decade, this activity has gradually transformed into the phenomenon of selling disease, which some have termed disease mongering. Commercial interests have assumed a more influential role in the activities associated with disease awareness and the promotion of drugs for these diseases. Their goal is to create as large a market as possible in order to maximize profits. The commingling of commercial interests in medical diagnosis and treatment is ethically questionable and can create potential for unnecessary medication and treatment. I'm going to compare disease awareness and disease mongering. Disease awareness is a useful and valuable public health activity. It serves to educate people about diseases and available treatments. The anti-smoking campaign is the best successful example of valuable public health education. These campaigns encompass warnings about ill effects of various lifestyle activities or inform about common diseases and possible remedies and treatments. There's no intentional profit motive in disease awareness campaigns. Disease mongering is defined as the manipulation of the definitions of diseases to expand markets for medical products. The boundaries of diseases are expanded as the goal is to identify as many patients as possible to maximize sales and profits. This creates the possibility of unnecessary medication or treatments being administered. These commercial interests are having a major influence on developing disease definitions, which I'm going to explain further. Disease definitions previously were developed solely by medical professionals and published in medical texts. More recently, pharmaceutical and other commercial establishments have representatives that participate in panels that develop criterion and definitions of diseases. Diagnostic categories are developed by those who have a financial interest in promoting the disease and selling its treatment. The authors of the reference article that I have used for this presentation raise the question of the legitimacy of commercial interests rather than the medical profession having a major influence on the ways disease definitions are developed and publicized. This chart shows examples of some diseases and conditions that have been identified by Duran and Henry, the authors of the reference article, as being subject to exaggerated promotion or mongering. The conditions are restless leg syndrome, irritable bowel syndrome, social anxiety disorder, and high cholesterol. These are all legitimate disorders and in many cases require treatment. The center panel of the chart shows the ways in which the reach of the disorder is expanded so that as many people as possible can be considered to have the disease. For example, restless leg syndrome could actually include anyone who tosses around in bed at night. That would be a minor symptom that's inflated to fit a category of a disease. Irritable bowel syndrome starts out as a bad case of gas, and it might well end there if it's given time to resolve on its own. Again, that's an example of minor symptoms that are inflated. Some people are just very shy, but they can be led to believe that there's something really wrong that needs medication, and that would be an example of a human variation that's pathologized in social anxiety disorder. High cholesterol is a risk factor for disease, but it is not the disease itself. However, its continuous promotion makes it seem that way. It also sells a lot of Lipitor, although a change in diet might be the solution. Finally, I just want to summarize and re-emphasize a few of the points that I've made. The increasing commingling of commercial interests and medicine raises ethical issues. The expanding of the boundaries of a disease can occur in order to create as large a market as possible to maximize profits. Skeptics and critics question the extent of influence on medicine by those who will make a profit from selling a disease and selling its treatment, as well as having influenced the definition of the disease itself. and a serious consequence of these activities can be possibly unnecessary medication or treatment. Awareness of the possibility of disease mongering by consumers and medical professionals alike can provide a counterbalance to the drug and disease promotional activities that are currently used. And now, if you'd like to ask me any questions, I can answer them.
Who are the authors of the reference article you're referring to?
The authors are Duran and Henry, and they are clinical research pharmacologists based in Australia. And they have taken a particular interest in the pharmaceutical industry's involvement in disease definition and selling pharmacy.
Don't doctors make a profit from promoting medication?
Well, doctors are in collaboration with the pharmaceutical industry, and they actually get a lot of freebies from the pharmaceutical industry.
It's not just the pharmaceutical industry that it's a fault, is it?
No, it's not. The doctors, the pharmaceutical industry provides conference materials and pays for conferences for doctors, as well as providing free samples of medication for their patients. And within the medical profession itself, there are those who criticize this practice and look very negatively upon it.
Isn't it true that high cholesterol can be very dangerous and cause heart disease?
Yes, it's true. However, there are other ways to control cholesterol besides medication, and that's not as well publicized as the commercials for Lipitor. Well, thank you very much for your attention.